So in today's Health Matters, life-saving resources for Staten Island residents are now available, and here's what's important: for free.
Yeah, it's so important. The borough is now home to 2 health vending machines, which have already dispensed more than 600 kits since they launched 3 weeks ago. Adrienne Abbate is the executive director of Staten Island Partnerships for Community Wellness, the organization that made it happen. Adrienne, thank you so much for being with us.
Thank you for having me.
Of course, we're just talking about how great of an idea this is, and we know there is a critical need, especially on Staten Island. We know these are free, which is fantastic. What's in these machines and how does it work?
Sure. So the machines have public health supplies that are available 24/7. Supplies such as naloxone, which is a life-saving medication that helps to reverse overdoses, but we also have feminine hygiene, we have COVID test kits, we even have reproductive health supplies, and some machines stock socks, right? And this is all based on what we heard from the community in terms of needed resources.
So how do you access the machine? Do you need a special code to kind of get in there?
All you need is your zip code.
Yeah.
It is completely free, completely anonymous, and you know, we just want to make sure that people who need services are able to access it 24/7, so that if you are in an emergency, you can easily get the supplies to keep yourself safe or your neighbors safe.
And we know there's a vital need for them. So how do you decide where to place these vending machines?
Sure. So we received funding via the New York City Health Department through our opioid settlement funds, and we did extensive research as the communities and neighborhoods most impacted by overdoses. We then worked with organizations. We went out and solicited community feedback about what they want, where they wanted to see the machines. And then we worked with partners to think about where would be the optimal placement in terms of also being able to access additional services. So we are working with A Chance in Life and Community Health Action of Staten Island.
So you launched about 3 weeks ago, right? What have been, I guess, the most requested products from the machines?
That's a great question. So we're seeing, I mentioned that we have both a mix of harm reduction supplies and also just hygiene supplies. So people are taking the wound care kits, they're taking the COVID tests, they're taking, we are seeing also a lot of naloxone being distributed. So it's a mix across the 2 different sites, and we're getting real-time data so that we can quickly track and replenish.
Right. How much does it cost to actually operate these machines? Is this something that taxpayers are going to end up paying for?
It is not a taxpayer-funded initiative. I mentioned opioid settlement funds. So just until a couple of years ago, Staten Island had some of the highest overdose death rates. And through a lot of advocacy of community organizations and leaders, we were able to secure opioid settlement fund dollars. And that is what is supporting the machines. We are supporting 2 machines now, and the funding also covers like our staff to keep track and make sure and get the word out. We're doing a lot of work around marketing and making sure that community members know how to access this important resource.
Are you encouraging more partnerships to even add more items to the vending machines?
So we have to, we are doing a lot of gathering community input, and we can adjust the items that are in the machine, but we have to, when the machines are designed, we have to let them know what because they're different, the slots are different sizes and spaces, so there's some planning that goes into it. But if we see a new need, we can certainly adjust the machine and make sure we're providing those services.
Yeah, absolutely. And it's really for, I guess, any income level. Anybody can use the machine, just to be clear. It doesn't have to be somebody who is...
Yes, it's for anybody who needs it. We are prioritizing neighborhoods where we know there's more economic stress, and this machine is such a vital resource given the affordability crisis in New York City. Being able to connect people with free services is incredible, especially with the sweeping cuts to Medicaid and benefit programs.
Is there, I guess, a limit to how much somebody can use a machine to prevent somebody from kind of taking something out over and over and over again?
We've heard that concern, and our response is we want the supplies to be out in the community, so we haven't seen that with other sites where people are just taking it and selling it or giving it away. But we just, a mark of success is how many supplies get out into communities, so we're not worried about that.
And talk about accessibility, this is it. So fantastic work. Adrienne Abbate, thank you so much for stopping by and joining us this morning. Of course.